Good evening, everybody.
Good evening.
Welcome to an MS Views and News program, our first in Ohio. My name is Stuart Schlossman, for those that don't know, and guess what? I too have MS. Isn't that cool? This is annoying. Isn't that cool, though? It's really cool because when I was first diagnosed, I couldn't find information from the healthcare community to give me guidance on what was wrong with me. And being internet savvy at the time, I decided that I'm going to just get on the internet and start finding the information. I started finding it for myself and for people in a support group. That started growing. Other support group leaders started finding out about it and asking me to send the information. What started off as us just sending information, or me starting off as sending information to just 20 people, now reaches over 35,000 in more than 90 countries. It's a good thing, right? You agree? Okay. Tonight's program is our 38th program of this year. When we finish this year, we'll have finished with 44 programs. And some of you are looking at me with a smile, and others are looking at me like, what's the big deal? How many weeks are in the year, everybody? And I'm on the road, and we're doing 44 programs a year. That's a great thing. So this is what we do. We're providing educational programs. MS Views and News, that's exactly what we do. We're just providing educational programs via live programs and what we do on the internet. Recently, I and a few others from our organization and a neurologist in South Florida put together a communication tool. And on this communication tool, it's something for you to use with your clinician about your MS. All right, what does it do? Well, everything that you have a question about concerning your MS, you can check off on this two-sided sheet of paper and bring it with you to your appointment. And when you get to your appointment, you give it to the person at the window and let them put it in your file. So that way when you meet with your clinician, they then see what is bothering you. Why are you there that day? Make sure you have it filled out, a week or two in advance of your appointment, and this way you're not forgetting anything that you're there to see. Because so often you could download this from our website, and we hope to have it in many of the neurology offices around the country in the coming years. But what's the point? The point is that a lot of people go to see or go for your MS appointment with your clinician, and you go through a bunch of things, and the clinician's like, well, what else are you here for? And you don't remember. But on the way out, oh yeah, I forgot. Look, I see heads going up and down, right? Oh yeah, I forgot. But now this doctor or nurse practitioner doesn't have time to speak with you, and they'll ask you to write it down and remember it for your next appointment. All right? So if you want, before any of your next appointments, you could just go to our website, print this, bring it, fill it out, bring it to your physician's appointment, and then you're good to go, and they'll know everything that you're there for, and there's lots less problems of communicating with your healthcare provider. This is to help you communicate with your healthcare provider, okay? All right, next. Sorry I have to go through all these things. Our learning channel I already told you about. By the way, we began MS Views and News. We did our first educational program in February of 2010. February of 2010, and like I said, well, I didn't say it, but we've now held over 180 educational programs since February of 2010. Again, there's a need. We started off just doing these in Miami, Florida. We expanded to Fort Lauderdale. We expanded throughout the state of Florida. People were then asking us to get outside the state and get into other states. We went to Atlanta, where we do a lot of programs each year. We're in Birmingham, Mobile, Montgomery. This is in Alabama. We got into Charlotte, North Carolina, Columbia, South Carolina. This year we went into Louisville, Kentucky, Chicago, Illinois, Indianapolis, Indiana. We were just in Novi by Detroit just a couple of nights ago, and now we're here. We're doing programs now in 10 states, and next year we plan on adding on another 5 or 6 states. Again, it's not just you guys that want information about everything that there is about MS, but everywhere in this country, there's a great unmet need, and we want to help to fulfill that unmet need. Enough about me. November 14th, we're doing our annual MS Symposium in South Florida. We used to do it in Miami. We ran out of space doing it in 5,000 square feet. We expanded it now to 6,000 square feet. Our largest audience in the past was 225. As of this morning, we have 327 people registered for that program. And to the benefit for all of you is we are now also doing this as a live webcast. So for anybody outside the state of Florida who we're going to announce this to, everybody and anybody living in the other states of the United States and internationally will be able to access this program as well. We have a very well-known, nationally known neurologist named Kotil Ramahan, who Dr. Boster knows very well. He's going to speak about the immunology about MS, what makes it happen. Okay? A lot of you have MS. You don't even know why you have MS. Well, he's going to tell you why. All right? Then we have another neurologist who's also nationally known. His name is Jack Burks. And Jack Burks is going to speak about the emerging therapies, including stem cell research, and give you all an update on that. And then we have another neurologist that's very well known in the Southeast United States, Brian Steingo. And Brian Steingo is going to speak about self-aspects, nutrition, and other things. After those guys, we're going to have a Q&A for all of them. Then we're going to have a urologist speak about what? Bladder issues, okay? And then we have another guy coming up, a personal trainer that does a lot of our programs, and he's going to help you all figure out how to get rid of spasticity. So when you wake up in the morning, you're more nimble and less taut, okay? All right, so you will get notice about this, but for those that may want to write this down right now, the web link for it will be www.symposiums.msvn.org. Yes, I said that fast. You ready? Symposiums.msvn.org. We will be sending out announcements by email, so if you could not write this down, you will still know about it. All right, before I continue babbling, how we do these programs, we get our dollars from the pharmaceutical industry, and we rely on the pharmaceutical industry to provide us these dollars. We don't ask for the philanthropics like other people do. We get our dollars from the pharmaceutical industry who want you all to know about your MS. All right, they find it very important, and they know that's what we are doing to help provide this. And so for tonight, and I hope all of you too, will thank Genzyme, a Sanofi company, for giving us the funding to do tonight's program, and I hope that you all thank them. Please remember that they really do want you to learn from these programs, that we do and that others do too. There are other MS organizations out there that do this, and the pharmaceutical industry knows that it's very important that you do understand what is happening and to know about all the treatments available. In addition to Genzyme, we had other sponsors that are here tonight. You met with them outside, and so I thank them for being here. Also, we have to thank the support group leaders that helped get the word out tonight, our volunteers, the National MS Society local chapter helped us get the information out, so I thank all of you for doing this. Tonight's format, Dr. Boster is going to come up and speak in a few moments, but before he does, we ask local support group leaders to come up and speak about their groups. So before I speak about Dr. Boster and the rest of the program and Sarah Grimm, I'm going to ask the first group up, that's Paul and Carolyn. Sorry, I know she's going to beat me up now. All right, but they're going to come up and listen. We feel it's very, very important for support group leaders not to just, you know them, but there are others that are going to be watching this later on that don't, and they may feel isolated with their MS. Well, maybe now they'll learn about a support group that's near them. So that's why we ask them to come up and speak. Come on up.
And I'm going to get you because you didn't remember my name. Yeah, I'm on you because you didn't remember my name, okay? All right? My name is Carolyn Sherman, okay? Paul Turner and I are support group leaders for the College Hill Support Group. We are MS Strong. I want all of you to know that. And I'd like my support group members to stand up, all right? Stand up, you guys. We got them all over the place, all right? What I want to tell you about, because I have to give Paul a chance to speak, we're going to have a really big Black History Month event on February the 13th, 2016 at the Marriott Kingsgate Hotel. I would like all of you to attend. That is February the 13th, 2016 at the Marriott Kingsgate, and our sponsor is walking up here now. She's got the pretty blue blouse on. Tammy Shelby is going to be. Okay, I'm just showing her. Yeah, okay. We meet the second Saturday of every month at the College Hill Rec Center. We're a family and we're MS Strong, and I'm going to let Paul speak.
Thank you.
How's everybody doing tonight? That's great. I just want you to know I'm part of the team out at the North College Hill Rec Center, where we meet once a month, every second Saturday of the month. And what we do is we come together. Not only do we just come together and we're like a family, but we equip each other, we encourage each other, we empower each other. And we make sure that everybody knows that you're not alone in this, we're together, and we're a great support team. So if anybody's out there and you just need somebody to talk to, somebody to be a part of, come out to see us at the North College Hill Rec Center with Living with MS.
Thank you. Thank you. All right, next up we have Helen and we have Meryl, and I think a lot of you all know them from here, so come on up, let them explain themselves.
Hi, everybody. I'm Helen, and this is Meryl. How many people here tonight have MS? Raise your hand. Okay, and how many of those people have come to any of our support groups? Just raise your hand. Well, Meryl's and my message tonight is, you are not alone.
Through our MS support group sponsored by the Ohio Valley chapter of the National Multiple Sclerosis Society, I've had the opportunity to meet with many of you, and I thank you. You opened the door to your daily existence and allowed me to peek through. Because of you, I knew there was someone who understood the impact MS has had on my life.
Being diagnosed with MS is like being stranded on a desert island. Everything is strange, and one doesn't know how he or she is going to make it. Fortunately, after I lived there for a while, I found there were others occupying the same space, and that they were friendly natives, willing to give me tips to survive and thrive. The MS natives told me how to find the healers.
I'm sure she meant doctor.
The native plants.
MS therapies.
And how to deal with the tsunamis
Symptoms
that occasionally accompany an MS diagnosis. Many MS hugs and happiness. Thanks.
Thank you, ladies. Thank you. All right, so without any further ado, let's get Dr. Aaron Boster up here, because the sooner he gets up here, the sooner we get food sent out to you all, and everybody can be merry, right? And then after Dr. Boster, we're going to have Sarah Grimm, who's a social worker, that's going to be speaking to you all she's from Ohio Health as well, and I think that you're all going to really enjoy tonight's program. So thank you for allowing me to be here, and I'll be back with you all later on. That's a good step up. Thank you.
I run a real large MS center. We take care of well over 4,000 families with multiple sclerosis in Central Ohio. And up until very recently, I had a horrible hole in my care. I knew that a patient needed a ramp, but I had no earthly idea how to even think about getting it. My patient was sad, blue, and depressed, and didn't have support at home. And I know that's bad, but I didn't know what to do about it. And my friends around the country, that large MS center, says, you gotta be a goofball, man. You need a social worker. And I tried to get a social worker, and at the time I worked at a large university, and they said no. And so I went to the dean. I was an assistant professor, and I climbed the mountain, and I knocked on the door, and I waited, and the dean gave me an audience. And I demanded something of the dean. I didn't demand more money or more vacation time. I asked for a social worker, and this is who I got. And she has changed our practice in a way that makes my head spin. Sarah Grimm does very, very special things for our patients. I'm honored that she came down here tonight, and I want you to help me in welcoming her to the stage. Thanks for coming.
Thank you, Dr. Boster. I appreciate that. Can everybody hear me? Okay, all right. Well, I do this on a daily basis. I always have to follow after Dr. Boster. And it's not right. I don't like it. I'm just kidding. But that's the joy that I get to work with 5 days a week. So I'm a social worker. I don't know how many people know a social worker. Maybe you have one in the family. Have you ever worked with an MS clinic social worker before? A couple? Okay, good. I'm glad. I think there definitely should be more of us, so you should tell your neurologist to get a social worker. But my background is actually home health, long-term care. And 2 years ago, I met Dr. Boster and have spent the last 2 years learning from him, learning from you. And I hope that today we just have an opportunity, or this evening, to talk about some common concerns at home and at work, as well as explore some resources. Let's talk about some possible solutions. And a big concept that we talk about in our clinic is the concept of social support. And it was so great to hear the local support group leaders talk about that concept of social support. It makes a huge difference, and you aren't alone on this journey. And that's a conversation that I have with all of our clinic patients is, what is your social support? What does that look like? What can we do about it if it's not as big as you want it to be? And finally, my final goal is that you leave with some ideas. I might not tell you anything earth-shattering. I'm not flashy like Dr. Boster. However, I hope I'll leave you with some information to take to your providers, take to your family, take back to work with you. Just really some things to think about. And before we get started, I do want to just share a little bit of information and stress the importance of social well-being. In the social work world, we call it psychosocial wellness. It's very, very important. Dr. Boster can work his tail off to find the right combination of medicines and treatments, but your social life, your social health is very, very important. And so we tag team a lot to help really focus on the whole wellness of the patients that we see. There's evidence out there that social support, feelings of social support absolutely affect physical health. So just some thoughts on that. I'd like to get started though tonight and just talk a little bit about some common concerns. You may have experienced these already, or you anticipate experiencing these things. And again, my goal is just to give everybody something to think about. We touched on this a little bit. How many times have you thought to yourself, if you're the one living with MS, my family does not understand what's going on with me? Do you have that experience? Maybe a little bit? Okay, all right. Actually, that's a pretty common conversation that I'll have with patients or their loved one, is that unless you live with it, and I don't live with it, but unless you live with it, you cannot possibly understand what fatigue means, those kinds of things. And so I try to work with patients and families and talk about the role changes that might happen for the individual that has MS and the people that love them. So a role change. If I live with MS and I'm typically the spouse or the partner that drives the kids around all day long to practice and school and those things, if I'm having a bad week or a bad 2 weeks, I can't fulfill that role. And so what does that mean to my family? And how do I help them understand that for 2 weeks I'm going to need some help with driving the kids around? Mood changes. Do we see any mood changes with multiple sclerosis? Our loved ones might not really understand why we are not as happy and jolly on Tuesday than we were on Monday. So I try to work with again, patients and families and thinking about how to make our loved ones understand those mood changes, and that it doesn't mean that if I'm having a bad week that I'm always going to be a little grouchy. But how can you help me get through this week? So we try to strategize around those ideas. And communication. I will meet with patients and their loved one will be in the room and they won't have discussed the impact of a role change, or they won't have discussed feelings of depression yet until they get in that room. And it's really, it's kind of awesome to watch this process unfold in a clinic room when two people that normally communicate very well, for some reason around the MS or the symptoms of MS, they're no longer talking about it. And so again, one of my purposes is to really talk about communicating thoughts and feelings and how do we problem solve, just for the short term. Doesn't mean that we have to switch roles for the rest of our lives, but maybe for a couple weeks. Another thing that I try to help people be aware of is that as symptoms vary, so do our adjustments to those symptoms. So one week, I might have some fatigue issues. The next week, it's not so much fatigue. Maybe I'm having some concerns with my bladder. As those symptoms change, our adjustment to those things change as well. And just really kind of keeping that open communication and asking for help. We had a couple weeks ago in our clinic, a patient that we had seen for quite a while was experiencing a relapse. And she was actually pretty devastated, very tearful. Her mother came to clinic with her, and our patient was so concerned about the kids and the husband. How am I going to go home and clean and do the dishes and do all the things I typically do during this relapse? And so I'm working with the patient and the mother, and I asked the mom, I said, do you think there's anything you could do to help while we address the relapse, the symptoms and the relapse, to help her not have to do laundry every day of the week or whatever it is? And the mom was beyond willing to be helpful. And the daughter just kind of looked at me and said, I never thought to ask my mom for help, or I never thought to ask my loved one for help. And I definitely encourage people to do that, to ask for more and kind of see what you get. The other thing to think about is that no one-size solution fits all. One-size solution is not going to fit every single scenario that you might run into. But I do encourage people to think about, what strategy did I use last time I was in a particular situation, and is that something that I can implement again today? And then also think about who else can assist. Are there neighbors that are good cooks? Are there church members that would take me to my doctor's appointment? Or any kind of groups in the community that might help? I encourage everybody to take full advantage of whatever network they have around them, and to explore ways to expand that network. Treatment options are confusing. I work a lot with Dr. Boster and the other providers. When an individual is considering their treatment options, it can be very confusing. And of course, the providers are going to, give as much information, as much education as possible. But sometimes it helps just to talk it out with other team members. So maybe you talk to the social worker about choosing drug A versus drug B, not because I know what they're going to do for you, but it's kind of a nice, safe place to bounce ideas off of. Talk to other people. There are chat rooms and Facebook groups that are focused on certain treatment lines. So I know a lot of people that get plugged in and get feedback on choosing this certain treatment, and what did you experience? Was it good? Was it bad? Was it worth it? It's nice to plug into those kinds of resources. The other thing I like to talk to people about is that decision-making process, the benefit of choosing treatment A versus the burden. Let's just talk it out and really try to make things, I guess, as transparent as possible. Again, not that I know what treatment you should choose, certainly not. But I like to be that sounding board, and let's write it down on a piece of paper. Let's do the pros and cons, because it's such an important decision. Choosing treatment options, think about the impact on daily life. Is that going to change my work schedule? Am I going to have to do monthly infusions? How am I going to explain that to my employer? Those kinds of things. How about transportation to and from treatment? All of those things should be considered when talking about treatment options. There also potentially could be a financial burden, although you'd want to talk to your social worker about those things and see what options you might have. And if I get a certain treatment, what support am I going to have at home? Am I going to have support? Am I not going to have support? Am I going to have to ask for more help? Those are the type of conversations that I have, when considering treatment options. Treatment is really expensive. that certainly could be the case. So working with individuals, considering treatment options, I talk a lot about knowing your insurance. Be the expert of your insurance. Sometimes treatment is best to do at the end of the year. You've already met your deductibles, you've met all those things. Sometimes you want to consider your insurance coverage. There's a lot of manufacturer's assistance. People may already know all of those things. Your hospital, your clinic may have some assistance. I know we're very fortunate at Ohio Health. We have a pretty generous assistance program. So even 25% off of my copay would make this treatment more affordable to me. So I encourage you to get on the phone, ask those questions of your clinic or your hospital system. Things like the Patient Access Network that can help with copays. They can link you up with some other grants that can help pay towards treatment. Then some other resources that I love, I use on a daily basis. I don't know if anybody's heard of GoodRx before, and that's not for your MS treatments. This would be for some of the other things that your antidepressants or an anti-anxiety or things like that you would want to, you could use this, it's a website, and you just Google the name of the medication, you can put in your zip code, and it will tell you where you can get it for the most affordable price. Now, if your insurance covers it in a way that you're comfortable with, that's not a problem. I myself have actually used it and found better prices on GoodRx than my copay would have actually been. So again, I'm just about exploring all of my options. And if I can save a little bit on my prescriptions, and that means that I can afford some privately paid for help at home, I want to do that. RX Outreach is another really good program. You can find these online. You can just Google them. But RX Outreach, that's actually a place where you can find Provigil, just as an FYI. But you do have to meet their eligibility requirements, but that's a medication that we find to be expensive sometimes. So that's a good resource for RX Outreach. Should I tell my employer? That's a really, really difficult question, and I can't tell you yes or no, unfortunately. I wish I could. I wish I could tell people for sure what they should and shouldn't do. But that's, again, a good conversation to have with your clinical staff, whether it's the social worker or your physician or the nurse that works in the practice, is the benefit and burden of talking to your employer. You don't have to tell them, but you might feel better. The benefit and burden of that conversation. I may be so stressed out that nobody at work knows that it's actually making me feel worse than if I actually opened up to my supervisor and had a discussion about what MS means in my life. So just thinking through the benefit and burden. Talk to your family about it. See what their thoughts are on whether my employer is somebody that I want to talk to about MS. Now, you most likely will have to disclose information if you are requesting an accommodation of some kind, whether it be a change in your break time or a change in where your desk is located. They're most likely going to require some information on the diagnosis, so just kind of be aware of that. Always encourage people to talk to their employer about family and medical leave. Probably 100% of our patients utilize that benefit when they're able to allow time for doctor's visits, for treatment, if somebody's having an exacerbation. So I work with almost all of our patients on the FMLA benefit and how to really tap into that resource. It's there for a reason, and it's a good thing to utilize. Also know your benefits. So not only your health insurance, but if you have short-term disability through work, or if you have long-term disability through work, really know that well before you need it. Have that conversation or have that knowledge before a crisis should occur. And your social worker or somebody at your clinic hopefully is somebody that you can talk through those things with. But definitely know your short-term disability policy if you have one. And another really great resource for dealing with workplace issues and or accommodations is the Job Accommodation Network. I don't know if anybody's heard of that group, but again, you can Google them, and they will give you, based on a multiple sclerosis diagnosis, they can give you suggestions on accommodations that you might ask for at work. And how to have some of these discussions with your employer. So when I'm talking about employment, those are some of the things I try to touch on. Now, before our program started today, I actually talked to 2 people in a very short amount of time about disability and applying for disability. And that's another very personal decision, but utilize your resources in your neurology clinic and get the help and get somebody in that clinic that can help answer questions and make sure paperwork is processed timely. I address a lot of Social Security disability type issues. So it's nice to have someone to bounce that off of. Again, nobody can tell you if it's time to do that, and we're going to do everything we can so you can keep working and keep that part of your life. But if for some reason that changes, strongly encourage you to have somebody to talk to about that. And how about being at work and having trouble with symptoms? We talk a lot about those issues, and so heat is an issue. Bladder, bowel issues might be a problem. Fatigue, like Dr. Boster said, the primary reason people stop working. And maybe treatment times when you're having your infusions. Those things, we can strategize and try to make those things a little bit better. So again, the Job Accommodation Network is a really good resource for accommodations, if you're looking into accommodations. I want to touch on fatigue a little bit because there are some really cool ideas that a physical therapist and an occupational therapist would have regarding fatigue in the workplace. Can you park a little closer? Can you move your desk a little closer? And maybe you use an assistive device just at work. You don't need it in your home life, but getting around the workplace, maybe that's a good time to save up some energy and use an assistive device. So when we're talking about fatigue especially, I definitely would talk to my provider about physical therapy or occupational therapy referral and really talk those things through. Having difficulty getting out of the house. That is also a pretty common concern with the folks that we see in the MS clinic. Home modification. I wish I could give people a free resource to get all the modifications needed in their home, and that's just not a thing that exists, unfortunately. However, maybe there are grants in your area. Maybe there's something through the National MS Society. Maybe they can give a little bit of money towards some modifications, small modifications in the home. So when somebody comes and has a question about how do I get help with home modification, I definitely take that on as a big challenge. It never hurts to ask. Let's make some phone calls. Let's see what is out there. Every little bit of information can be helpful. Again, it's kind of the same thing with vehicle modifications. Those things may be a challenge to come by, but there are ways of finding little bits of help. And so I strongly encourage you to kind of put your detective hat on or work with somebody in your clinic to put their detective hat on and find out some more information about vehicle modifications. How about local transportation? Can I link up with some local transportation to get to and from work, potentially? To and from church or the library. There, in big cities like Cincinnati or Columbus, there's definitely access to more resources. But I would never stop looking. It may be a local church that has a van that they'll use on Wednesday evenings to help the community out. You have to be a little creative sometimes, but I definitely think it's always worth looking into. One thing I really like, at least in Central Ohio, I imagine the Cincinnati area has something close to that. There's a huge carpooling ride-share program in Central Ohio, and it's through the, I gotta find the name, it's the Mid-Ohio Regional Planning Commission, and it is a ride-share program, and it's basically a list of, and I hope this doesn't sound like Craigslist, because that's not what it is, but it's a list of people in the community that believe in less cars on the road, less gas in the air, and therefore they like to commute with people. And so if I'm an individual who, because of MS symptoms that I'm having, I can't drive right now, but I can go to work and completely do my job, but I cannot get there. That might be a good resource, so I find somebody who's in my side of town, who's going to that side of town, who, if I give them, $20 a week or something, might help me get to and from work. And again, that's not Craigslist. This is a legitimate database of, not that Craigslist is bad, but be careful who you get into a car with. But so just kind of some things to think about. And I know for certain that's available in the Columbus, Central Ohio area. But I would imagine Cincinnati and the bigger cities would have access to those kinds of things. Medical transportation, certain forms of insurance will help cover some medical transportation. Not all of them do. So I wish they did, but they don't. But it's worth looking into. See if there's any kind of assistance in that world. The Red Cross sometimes helps with medical transportation. If you're 60 and older, your resources definitely open up a little bit more as far as transportation options are concerned. So you just kind of have to dig in there, and if you have somebody in your clinic that can help you do that, that would definitely be a phone call I would make. We see a lot of individuals newly diagnosed in their 20s, in their 30s, and they are scared to death. What does this mean for my future? Am I going to get married? Am I going to have a family? Am I going to have a career? Those are conversations. So those are questions that we want to talk about. We don't want you to go home and have these thoughts by yourself and not have somebody to process that with. So, when we're talking about an uncertainty, which I think is a pretty big deal in the MS world, we can definitely expect there to be change. So how we feel today is not necessarily going to be the same as we feel in a week or 2 weeks. So we can anticipate some of those things and maybe be a little proactive and plan for the times when we're not feeling that great. Utilizing previous coping skills. We've all had struggles and hard times. What did you do then that helped you remain resilient? Can we do that again now when we're having maybe a little bit of a low period or some symptom issues? Phone a friend. Talk to somebody. Always, always, always talk to somebody. Dr. Boster will refer people to me and he'll say, show them some love. And that's an intervention. That's what we do. And you get that in your clinic, get that in your home life. Have somebody to talk to. And get support. Support groups are one of the best ways to get the right kind of support. Hearing from people who have gone through it before and made it through. How did they do that? I want to talk to that person. So definitely encourage people to get linked up with support groups. We are very fortunate to have the space in our clinic to offer several support groups, and it's really been a nice connection for our patients. That's coming up. We actually have designed support groups to maybe meet some of the subgroups in our client or in our clinic population. So we have a 20s and 30s group, so the millennials group, and that has turned out to be such a wonderful connection amongst the people that have come to the group. It's so not about what I know and what I can tell you. It's about the connections that they make within the group. So it's been really exciting to see it's all women right now, young women. They hang out after support group, they hang out on the weekends. It's just been a support that they didn't have before. We also have a patients and partners group. So it's husband and wives, or it could be, me and my caregiver, whomever, and talk about the good, the bad, the ugly of living with this, with a person that you love. That has also been a really great group. We have outreach for families, so individuals living with MS who have kids who are 6 years old to 11 years old. How do we parent with MS, and how do I make my young child understand what's going on with me? So we wanted to create an opportunity and create space for those kinds of conversations. And we additionally do a new patient information session each month for anybody newly diagnosed or diagnosed within the past 6 months, people who are new to the clinic, who just have some general questions, who want to see the providers outside of their appointment times, and possibly meet other people who have been recently diagnosed. A conversation that I actually enjoy quite a bit is the living well conversation. What does it mean for you, living with MS, to live well? That's a personal, completely personal decision. I don't know what that means, so we talk about it. How do we prioritize and really focus on the things that are important? Do I have to bake cookies for my daughter's class every single Monday night for the rest of my life? Probably not. Maybe somebody else can do that, and I can enjoy time with my family. So those are conversations that are important. Thinking about who and what makes you happy. I don't know that we give ourselves the opportunity to really have those thoughts, but really think about what's so important to you, so you can focus, your energy on those things. What's a source of support? Is it your support group? Is it your spouse? Is it your church? Really think about those resources that are available to you and try to tap into those even more. And what's most meaningful right now? Again, baking those cookies or time with, your loved ones. So, and maybe cookies are more, more meaningful at some points in time. However, it's really nice to have somebody just to really play around with those thoughts and think those things through. So, touched on the support groups, and again, I really love the support group leaders that were here tonight to really open up and share, and I like the concept of the natives. I really think that's a really good concept. So building a support group is really essential. What is a support system? That's a very good question. These are rewarding relationships. So these are people that we actually like to spend time with. It's a positive relationship. It's very helpful in nature. And why have a support system? If I'm just an individual, I can handle everything on my own. I don't need anybody to talk to. Yes, you do. We all need somebody to talk to. And working to build those nice connections is something that we strongly encourage. And again, there's a definite connection between social wellness and physical wellness. Where can you find more social support? Support groups. Definitely a big fan. There's some meetup groups that you can find online. Those Facebook connections, online communication. I just encourage people really to make sure that they have a strong set of individuals in their village to help support them as they have their ups and downs. So my goal here tonight was to talk a little bit about creating a support system. I hope we've talked enough about that, and strongly encouraging everybody to use the full staff of the MS Center, whatever that looks like. If they don't have a social worker, get really friendly with their nurse or their MA or their physical therapist. They are part of your village, and you definitely want to take advantage of the services that they offer. Hoping that we've had a little bit of discussion about prioritizing what's really important now, and taking advantage of those good relationships and accepting assistance from others. It's not easy. We don't want to ask for help, but do it, and hopefully you'll see that really positive outcome. Those are some of my references, but that's all I had tonight.
So like we did before, questions. Sarah's on that side, I'm on this side. Do we have any? Any hands to go up? So, everybody in this room knows, thank you. There's one down there.
Please, thank you.
Thank you. I feel like we're giving out tickets.
I just wanted to know where you guys are located.
Oh, yes. So, and I didn't say that, I'm sorry. We are at Ohio Health in Columbus, Ohio. Yeah. I don't know if Dr. Boster wants to say anything else about that. Yes. Oh, yes. Yes.
Thanks so much for your presentation. Do you have any idea why there's such a lag in allowing social workers to help with coordinating care and aftercare for patients with MS?
That's a very good question. I don't think people are necessarily aware of how beneficial it would be to a clinic to have that social worker. Dr. Boster's had clinic without social work and clinic with social work, and of course he thinks I'm wonderful, but he definitely knows the benefit of social services. It costs money, I hate to say, and you might not necessarily be able to get reimbursed for some of that money, but you could. Potentially. So I just don't know if it's very well known. I would definitely love for everybody to call their neurologist tomorrow and say they really would like a social worker in clinic.
If you are that baseball player and every time you go to your neurologist, they tell you how wonderful you look, but you have been doing the best you can and using all of the resources you can to just barely get by, and you do not have a social worker, where is that first place that you go to find out about Social Security disability?
Sure. So I think you can probably call, I know that Stewart's group has a social worker. There are social workers out there. So if there isn't one that belongs to your clinic, there is one in your community. So MS Views and News would be a good resource. The National MS Society has social workers and outreach coordinators on staff. We work really closely with the folks in Ohio, so I know that they're fabulous. But there are social workers out there. Maybe you belong to a hospital system. Maybe there's a clinic social worker somewhere that has some extra time to sit down and meet with you. But additionally, there are things in the community called benefit banks. BANKS, benefit banks, and they're kind of like a full-service social work resource person, and you can actually meet with them in a location and talk about any community resources that you might be eligible for. So that might be a good one too. Additionally, as unfun as it might sound, call Social Security. We do it all the time. You might have a good conversation, you might not have a great conversation, but getting in there and asking all those questions, I would recommend.
Question over here.
Yes. Isn't it best that if you got a regular physician and your physician send you to another doctor because you need to have surgery done? Isn't it best to let your your neurologist know that you need to have this surgery done just in case he felt maybe your health ain't good enough to take it?
So I think we, in our office, we definitely want to know what's going on with the whole person. Right. We can't judge whether or not you should have it, probably. Definitely not me. But, I got a call actually today from a patient who just wanted to make sure Dr. Boster knew that she was in a car accident. She's okay, but she wanted to make sure that her neurologist knew. So I'm all for open communication and making sure your clinic, your neurology staff know what's going on with you.
And isn't it also you might be taking some kind of medication besides the one for MS that your doctor that's going to do the surgery needs to know that you take this medicine before he do the surgery, so
Sure.
that you can get off of it before you have the surgery, but not take it when you're having it?
Yeah, potentially, absolutely. So that's why communicating with your physician's office is good, and doctor-to-doctor phone calls are good as well if that's necessary.
Any on that side of the room? I don't have any over here. Anybody over here? Okay.
Hi. What is the best part of the country for resources, quality of living, for MS people? Is there one part of the country that's a lot stronger? I mean, you guys even seem stronger with your
Columbus, Ohio, but
research than we have here.
Yeah.
We have like the clinics. We don't have anything like that in Cincinnati, I don't think.
Well, you might. I can't honestly speak. Dr. Boster might know a little bit more, but call around. Call around. I'm sure your neurologist is fabulous, but definitely call around. You want the best of the best. So I would just get on the phone and start calling. Stuart might have some feedback on, where he sees good things happening as well. So I would reach out to just reach out.
Thank you. Anybody over here? Wow, it looks like they just want to get to the raffles, but thank you.
That's okay. All right. Thank you, guys.
My thanks to both of you and Ohio Health for letting you all speak. Again, thank you, everybody. You're free to go now.